Hello and welcome to today's webinar, 2019 Healthcare Trends. Thank you for joining us. And before we get started, I want to take a moment to go over a few administrative details. As you have noticed upon joining the webinar, everyone has been placed on mute for the presentation. At the end of the presentation, there will be a Q&A session. So in your GoToMeeting control panel, you'll see a questions box. Please type your questions or comments into the field and hit enter. Please note that the recording of this webinar, along with the slide deck, will be emailed to all of our registrants following the live webinar, and we actually already have the slide deck in PDF format available for you to download from the handout section in your GoToWebinar control panel. Without any further ado, I'd like to go ahead and hand it over to our speakers. Ed Hafner, would you like to take it away?
Yeah, sure, Sam. Thank you very much. And again, welcome to the webinar today on healthcare trends. We have a special presenter, which will be going over her bio soon, which is Amanda Coleman from the American Medical Association. And I am Ed Hafner from Change Healthcare. You can kind of advance the slide here, Amanda. Here's our witty disclaimer. We are going to be expressing our opinions and not necessarily Wheaties opinions, so please don't base all your decisions based on what we say. Amanda will be much cooler than me, I'm sure. So we'll do our best to convey what we're seeing in the marketplace. Next slide, please. So our agenda today is we'll actually have two different sides of healthcare. I'll be covering the health plan trends of what I'm seeing in the marketplace, where Amanda will be covering both more of an industry view and a provider view, talking about the following topics of disruptive technology reality check, shifting industry players, tipping point for value-based care, other forces impacting health plans, and a shift from population health to social determinants of health. So get ready for that. But first, I'll start it off. Here's our bios coming up. And Amanda, if you can introduce yourself, that'd be awesome.
Sure. Thanks, Ed. And hello, everybody. It's great to be here today, and thank you for having me. My name is Amanda Coleman. I work at the American Medical Association in the strategy group. And so the name of my team is a pretty long name. So we're the Environmental Intelligence, Strategic Analytics, and Market Research team at the AMA. And really what the focus of our team is we work to assess emerging elements in the healthcare and business environment, and we really look to kind of maintain a current pulse on healthcare trends. So some of the things that we work on, so we do market research, intelligence gathering, a lot of industry analytics, partnership, and innovation activities for our innovation ecosystem. So I've worked at the AMA for about 3.5, almost 4 years now, and before the AMA, I was working on my master's in public health from Mount Sinai in New York City. So I'm looking forward to today's presentation.
Okay, thank you, Amanda. And if you can advance the slide, I am Ed Hafner from Change Healthcare. I'm a strategist that works for really the clearinghouse business of Change Healthcare, but also including all the payer solutions that can be added to those experiences. I'm trying to, my MO at the end of the day is trying to make EDI cool again, or otherwise optimize all the different value propositions EDI can bring to health plans. And I'm focused quite a bit on the pre-adjudication space, comparative analytics, and solution integration. I do visit health plans about once a week at least, and then I have web conferences probably 2 or 3 a week as well. So what I'm going to bring to you is probably a little bit more tactical slash, maybe less of a high-level strategic focus that Amanda will be giving. But I was asked to share some of the things that I am seeing in the marketplace. So we'll start off with the first slide. So some of the very basic things I am seeing from the health plan market. I'm seeing a lot of focus about moving a lot of the adjudication edits forward. Today, when adjudication system denies, we're seeing about a 6.5-day delay for an 835 or a remit coming back saying, hey, this particular claim has been denied. If you can go ahead and move it towards the front end, whether it be in the EDI space or pre-adjudication process, you can go ahead and reject right away, get a claim acknowledgement back to the provider so that they can quickly fix their problems on that particular claim. So it reduces provider calls, and hopefully for both the provider and the health plan, it helps save expenses on for the claims operations rework on the health plan, and improves the revenue cycle for the provider. Also seeing a rising interest in doing estimation for a number of the larger health plans out in the marketplace. It better sets member expectations, which seems to be a competitive focus for a number of health plans again. As people are moving towards more value-based, capitated episode bundling type of processes as opposed to the typical fee-for-service, there seems to be a rising need to have more automation. Fee-for-service has been in place for quite some time, and it's been automated by many of the adjudication vendors as well as the health plans themselves. But to be able to automate some of the more of the risk reward, where you're giving people extra compensation for a job well done, or potentially penalizing something for not well done. It's something that there's a lot of work with HEDIS and other types of measurements, capturing how you're progressing towards bundling for your episodes, as the encounters are coming through. So a lot of focus are more on the value-based adjudication processing. And we're seeing that is a trend that's going to continue on growing. One that surprised me in the market, and I've actually seen this in multiple plans, is a focus on enrollment processing. Automating the A34 or trying to get things electronically, enrollment in electronically, to be able to react to those 834s and have application systems interfacing with their membership systems. It's something I'm seeing quite a bit on. I've seen some health plans actually make some very, innovative types of benefits that they actually are automating with the 834 membership. So pretty cool stuff, and it's nice to see membership getting involved with the HIPAA, and also exciting for the industry. We can go on to some more of the advanced trends on the next slide. So, EDI is some real richness to it, as well as the clinical transactions for HL7 type data, and to be able to react to that data as the data is being ingested by the health plan is an area of focus I'm seeing. You'll be able to scrape off information from eligibility or for clinical transactions to be more aware of what's happening with your members in a timely basis, particularly to better your care management organization. Seems to be a nice trend that's progressing. I'm certainly seeing a big move towards analytics. Many health plans are building their own analytics department, as well as being able to gain insights competitively. How well are you performing compared to your market? So having some comparative analytics as well seems to be very interesting, related to your provider network or related to the adjudication type process. That will continue to grow from what I can see. Coming to AI, I'm seeing that much more from the machine learning perspective, gathering information historically from all that rich data, this rich data repositories of the claims and the payments and eligibility and prior auths and all the different transactions, and be able to come up with different algorithms to predict the future, potentially using that information to do things like payment estimation. Is this claim, could that possibly be denied? Is this going to require a prior auth? Is it going to require an attachment? Be able to utilize information history to come up with whether there's dual eligible, another health plan that's involved with this particular member. So also seeing that. Next slide, please. Some more advanced stuff. Seeing some really interesting movement on natural language processing, particularly related to clinical documents. To be able to have an NLP process to be able to extract the meaningful information that you can automate and use. I've seen that certainly talked about quite a bit on attachment. So a claim is appended or prior auth, needs more information, to be able to ask for more information, to be able to use NLP to be able to understand that. I've seen that in many different forms, even from a printed information, to be able to have OCR or object character recognition, to be able to digitize something and to be able to pull out meaningful things that you would typically search for, what you're looking for. Certainly also for the clinical, pure clinical data as well. I'm also seeing a pretty interesting play related to looking at risk adjustment. So taking a look at a particular a member that should be considered for more of a care management type program, and to be able to bounce off the encounters off of there to make sure they're coded correctly. So say, for example, you may have foot pain, but you didn't include that they were a diabetic, type A. My goodness, if you would have coded that in your diagnosis codes, there would be much more potential revenue coming back to the state as opposed to, just saying it's foot pain. Also seeing information being used to be able to look at provider charges, making sure that they're in line with, the other providers of that particular specialty or that particular type or for that particular procedure. And of course, a lot of focus on membership, and being able to get tools to be able to allow for members to be able to manage their own care, to be able to, get information about, their particular type of treatment, to be able to select providers, to get estimation, like we talked about before. So all sorts of focus provided there on whether it be on your iPhone or Android or on the website. And next slide, I'll be talking about some of the things that we have to do from the health plan perspective. Reducing costs is extremely important. So we're seeing people really focusing on reducing mail costs, to be able to automate things, moving towards EFT and virtual credit card for payments, converting EDI to paper to EDI, also going the reverse. So there's a focus there. Of course, Medicare and Medicaid requirements to keep your directory of provider information up to date is a very important focus for health plans. And so I'm seeing a big need to be able to make sure you have the most current information. So when CMS comes and audits you, that you're able to achieve the percentages that will make you pass your audit and avoid fees. And of course, the most exciting thing that's happening right now, in my perspective, is the interop role. To be able to provide information without, being able to fill information out to the members themselves without withholding information, and all the different sort of certification requirements there, the privacy requirements, all sorts of wonderful things that I think is exciting to be able to allow for things to be published from the health plan and encourage the provider and payer clinical exchange. So I'm sure at the WEDI conference we'll be hearing all sorts of updates related to that. And I believe that's my slides for today, Amanda, and I'm going to give you the bulk of the time to talk about your trend.
Wonderful. Thank you so much, Ed. So, all right. So here we'll shift gears a little bit, and my presentation today is going to be about a broad healthcare trends outlook for what's going to be the remainder of 2019. So a little background on this presentation. So every year in the first quarter, my team here at the AMA, we review a bunch of healthcare trend predictions that are written by industry experts and external organizations. From there, we read through all of the reports and develop a list of kind of what are the top themes that we're seeing, what are some of the common themes from these reports. So today I'm going to be talking about the top themes that we've identified for 2019. Again, this is what the experts and the reports are saying. So I will be curious. I know we have a lot of industry experts, healthcare plans on the phone today. So please, as I'm going through the presentation, feel free to type in the little chat box that you should be able to see on the side of your screen. We'll also, if we have any questions at the end, I know Samantha will be going through those. So, all right, let's get on to it. So, as you can see here, I've outlined, we've done this report for a few years now, some of the common trends that we've seen across the years. So there's been a lot of talk with technology. So these emerging technologies, cybersecurity, value-based care, these have all been kind of common themes over the past few years. So this year, the top 5 themes that I'm going to go into more detail today. So the first one that was the most common across the reports I reviewed is this concept of a disruptive technology reality check, right? So we've been seeing and hearing a bunch of hype about these emerging technologies. So AI, machine learning, digital health, broadly speaking, telehealth. And what the experts are kind of saying is that this year may be more of a reality check for these technologies. So we've been hearing about them for a while. Will they deliver? The second most common theme from these reports is really this concept of shifting industry players. So we have all of these non-traditional players entering the healthcare space, and it's really changing up the game and frankly something that we really haven't seen before. The third theme that I'll go into is this notion of this year may be a tipping point for value-based care. And then following that, of course, there are other forces that impact health plans. I know I touched on a bunch of what he's been seeing, so go a little bit into that. And then finally, I'll go into this year, the experts are saying that we're going to start seeing a shift from focusing on population health to looking at really the social determinants of health. So, you know, the conditions that people are born in, the environment that they're living in, and how that may play a factor in people's health. So it's certainly an aspect of population health, but a little bit of a different viewpoint. Okay, and again, please feel free to type any questions you have right into that little chat box. I'd really love to hear kind of if these themes are consistent with what you guys are seeing, or maybe there's something that you're surprised with. Maybe you're surprised that something's not on there. So definitely just let me know in that little chat box. All right, so our number one theme, again, is this notion of a disruptive technology reality check. We've been seeing a lot of hype and excitement around technology. And of course, this appeared in the most reports that my team reviewed. And a couple sub-themes from this are really mixed speculation on whether this year will be the year that telehealth takes off. You know, we've been seeing telehealth the past few years, and there's definitely been more awareness, but I think that the uptake has still been relatively low. So there's definitely different opinions on whether this year will be the year that there is more of an uptake in telehealth. So the second sub-theme is really there's this debate over what will be the near-term impact of AI and machine learning on healthcare. So, of course, there's a lot of talk around, well, will AI replace me as a physician? Will AI, take away my job as a lawyer? Or maybe will AI help me in my job and not take it away, but be more of an assistance and help people do their jobs better? So certainly a debate there, as well as, of course, stakeholders asking for more tangible results from these technologies. So we would like to see how you are using it in your practice, or how you are using it within your company, and what are the results here. So what I've done is, for each of these themes, I've pulled out a few quotes here that I thought were kind of meaningful and sort of explained the theme here. So Frost & Sullivan, so they're a research firm and a consultancy, and kind of what they're saying around these disruptive technologies is that, AI, they really think that this is going to be the year that it will explode across the healthcare sector and really, provide more use cases with positive results. They're also saying that blockchain may move from more of a hype to reality with some actual commercial implications. So last year, it really was a monumental year for healthcare innovation and healthcare investment. So Rock Health, they found that 8.1 billion was invested last year in digital health alone. And that's a really significant number because it's more than 2 billion more than the investments in digital health in just 2017, so 1 year prior. And it's nearly double the amount of investments from just 2014, so a few years back. So we're really seeing a lot in this space. Premier, again, they think that AI and these predictive analytics will have this profound impact on the delivery sector. So athenahealth, they offer a bunch of HIT solutions, EHRs. So they think that these traditional analytic methods, they think big data, business intelligence, that will soon be replaced by machine learning. But they're predicting that AI really will not replace clinicians, more so it will augment them. And then HIT consultants, and this was a neat point. So they think that valuation for digital health startups will peak this year. And they were saying that because they think that with this impeding economic slowdown, it may cause investors across the industries to pull back, and there'll be sort of these new entrants that were investing in digital health, but they may return to industries where they're more comfortable. So again, this is their prediction, and if that comes true, they say that this will leave a favorable investing market for maybe some of the more proven, steadfast industry investors who are used to this space. Okay, so, yep, and then Venrock, so venture capitalists here, and they think that maybe 2019 will be the year that payers finally realize that it's better for them to actually embrace these new technologies, such as telemedicine, as opposed to sort of burying it and kind of ignoring it. They say unengaging member portals and clumpy mobile apps, but I think that's really dependent on, the source and different things. So thought that might have been a little bit harsh. Right. So moving on to the second theme here. So this is the non-traditional players that are entering the healthcare space. And I think this has been a fascinating space to watch. So some more innovative companies are really looking to kind of break into healthcare and tackle some of healthcare's greatest issues. So we have the recent JP Morgan, Berkshire Hathaway, and Amazon merger. They are recently dubbed themselves Haven. And so they're a nonprofit that's going to be tackling healthcare. And they really have some powerful players who are, going to be a part of this company. So their CEO is Atul Gawande, and he's a renowned surgeon and writer on healthcare. They have their chief operating officer, Jack Stoddard, who is another seasoned he's a health tech executive. They have the former chief technology officer of ZocDoc, which is a doctor booking app. He's also on board. And then we have Dana Gelb-Safran from Blue Cross Blue Shield in Massachusetts, who's going to work on their analytics. So it's going to be really a really neat point to watch and see kind of what their strategies are, and as time goes on, what they're working on and what they're doing. And then, of course, we have CVS and Aetna, that acquisition, as well as Apple's healthcare, or their health record initiative. So really a lot going on in this space. And some of the sub-themes that I found as I was reading across these reports. So there's predictions, again, we'll have a clear picture of the strategies of these new entrants, as well as more partnership announcements. And they're speculating that there'll be more partnerships amongst payers, healthcare systems, and also retail. So also, of course, now these health systems are going to be competing with these new entrants, which traditionally maybe was not as much of a problem for them. And then this point here, so consumer willingness to receive care in more of these non-traditional settings. So consumers really looking for what's convenient, what's cost effective. if they can get their care in a retail clinic or a different setting, then studies are showing. There was I think it was from PwC, a report that talked about the consumers, their attitudes and willingness to go to these non-traditional settings are a lot higher than they have been traditionally. So a couple quotes here of note. These non-traditional players, Frost and Sullivan is talking about how they'll really help these public health systems to ensure accessibility and affordability of care. HIT Consultants, so they're a healthcare news source, and they think that partnerships between retail and large healthcare systems will really be prevalent throughout the year. So they were mentioning, again, the CVS and Aetna, Walmart, Walgreens, Rite Aid, Amazon, and Target. They think all of these players will be really active in creating the new access channels. So from the retail setting to more high acuity settings such as hospitals. And, with Amazon, Berkshire Hathaway, now Haven, we'll really see kind of what their first initiative will be when that's unveiled. So let's see here. Premier is talking about how the health system, so they're really embarking on these integration efforts of their own to expand their network, so across broader geographic ranges, and with that being the goal to compete with these new entrants, create scale and achieve it, succeed in APMs, and really the bottom line here is delivering value to payers, patients, and of course participating providers. All right, moving on to the third theme. So this theme is really around this year being the tipping point for value-based care. So value-based care, we've talked about it, we've seen the uptake. So there's kind of some speculation that this year there'll be much more of a debate on what the drivers of value-based care are and what the market response will be. There's also speculation that we'll have new value-based care initiatives from Health and Human Services, as well as a shift to two-sided risk models. So more of a shift in accountability, which will aim to incentivize providers to really make smarter healthcare utilization decisions because they're taking on this upside and downside risk. Also speculating to see more active participation by physicians in value-based care programs, as well as some more tech-enabled service offerings. So some meaty quotes here. A couple of things to note. So Frost and Sullivan, they actually think by the end of this year that up to 15% of healthcare spending globally will be tied in some form to value and outcome-based care concepts, which is pretty huge. Premier, they think really this year, they're calling it the value-based care, the training wheels, and they think that they'll really come off this year so that more providers will be entering into these alternative payment models if they haven't done so, and that there's more opportunity for them to enter in these risk models. So, of course, there may be some resistance, but options to resist, they may become increasingly narrow. HIT Consultant, in their report, they were talking about with HHS expecting them to launch new value-based care initiatives, that there will be a handful of both voluntary and mandatory programs across a wide range of specialties. They noted cancer and cardiac, as well as new bundle payment models, and they were talking about more of a practical approach and lessons learned from early on and what they're dubbing value-based care 1.0 during the Obama years a few years ago. And then HIMSS is talking in their report about consumer demand for more access to personalized inpatient care. So again, that's what I was talking about earlier, is just the demand for more convenient care that's cost-effective and transparent as well. So besides value-based care, of course, there are a number of other different trends that really will impact health plans And here, this is really talking about the political climate, so patient-centered care, the economy, as well as uninsured and access to care. So some sub-themes from this theme that I found in the reports, they are talking about that this year there'll be more collaboration between health systems and health plans, but that does not always really go easy. Changes in the ACA that could impact coverage. Health plans that will work more towards connecting patients with care, as well as growing numbers of the uninsured. So Healthcare Dive, in their report, they are really talking about there actually may be some friction between providers and payers during contract negotiations, and they're saying this may happen even in the value-based care setting. Deloitte mentioned in their report that the most successful health plans they think will likely be those that are able to really connect their consumers with care. So helping them find providers, helping them find specialists, and that this collaboration between the health systems and health plan will be really increasingly important. Forbes mentioned in their report that a probable downward turn of the economy really maybe have direct repercussions for patients' access to care. They think that this will cause the numbers of the uninsured to increase, and American Hospital Association was saying something similar in their report. So they think that health insurance enrollment could really be reduced by elimination of the individual mandate penalties and the Affordable Care Act. And they're speculating that this really could have repercussions in the next few years. And then, of course, Medicare Advantage, that's going to continue to be a profit center for insurance, but also a growth opportunity for payers as our population continues to age. And we were doing some research for an event that we held internally at the AMA, and we're really, as the baby boomers continue to age and become seniors, we're really going to have this growing number of elderly population, and frankly, a physician shortage and not enough people to take care of this population. And then PwC in their report, so they're talking about how, so the Affordable Care Act is still intact, but there are changes to it, and that's going to have direct effects this year as the year continues to go on. So final theme that I'd like to touch on that was mentioned in these reports is this shift from focusing on the broad aspects of population health to really narrowing down on the social determinants of health. So the experts are saying that this year they think that we'll see more partnerships between payers, providers, and the community, specifically to tackle these issues in social determinants of health, and also working towards achieving health equity. So some sub-themes from these reports that I found, so more investments in this space. The rise of food as medicine, so really recognizing that besides our traditional medications, diet plays a huge role in disease and your overall health status. So as the years go on, some of the reports are talking about, they think that this will become increasingly important, and especially this year. There was a mention of behavioral markers and using those as an indicator of risk factors and disease. And then, of course, and this probably comes to no surprise, but continuing work to tackle the opioid epidemic and really figure out treatments for chronic pain that are non-addictive. So a couple things to point out here. Deloitte, they're saying that, of course, this will be a hot and button issue this year. American Hospital Association, they think that population health investments will increase by at least 20% this year, specifically addressing the social determinants of health. And I think that's notable because while social determinants of health have been mentioned in past trend prediction reports, it was never really a top theme, and this year it's getting the much deserved attention that honestly it probably should have gotten for a while. So talking about food as medicine, HIT consultant, the news source, they think that this year it will go sort of mainstream, and also that there will be more partnerships with food banks and food stamps, and some community programs for people who maybe are in a food desert or cannot afford their next meal. And this is a pretty large step in, working towards what they are dubbing as unbundling the social determinants. And then the last point here I'll mention is Foley and Lardner, which is a law firm who conducts research as well. So they're talking that they're predicting that healthcare organizations are going to continue focusing on really working to prevent opioid misuse and help patients who are struggling to recover from opioid addiction. And a big part in working to tackle this issue, which is a multi-pronged approach and clearly, not an easy task, but really unveiling these behavioral markers and social determinants and kind of getting the backstory on these people who are recovering or going through this illness. So with that, I've linked all of the reports here in the appendix. And so if you'd like to, dive deeper on any of these points, please feel free to look at the reports. I've had the logos next to the quotes here, and all of the reports are also linked there. And again, happy to answer any questions. I know Ed is as well. Our contact info is here. And with that, I'll turn it over to Samantha, I believe. And thanks so much, everybody, for listening in.
Thanks, Amanda. Great presentation. We do have some questions. And if anybody else has any questions, please feel free to type them into your GoToWebinar control panel so we can get all these questions asked and answered for y'all. First question, what has happened with blockchain? There was so much talk about it 1 to 2 years ago.
Amanda, would you like me to go first?
Yeah, go ahead. I'm certainly not an expert on this issue, so I would love to hear your perspective, Ed.
Thank you, Amanda. I'm finding that people value blockchain as an important tool. I know through the past years, looking for that magic application hasn't quite revealed itself. However, I see people using it for things like logs that people can't change, information related to provider directory, so that you can go ahead and gather different entries and put some little AI to it to be able to determine which is the most reliable. It's more of what I'm seeing is it's more of a tool, much like a database is for an application. If you need to have a log, for example, of status, it hit this process, then another process, and it can be, modified. It's something, once you make that entry with your application, your status is there, for the viewing. Yes, I see blockchain being very important. However, I don't see it as being something as big as something like machine learning or fire or other trends like that. That's my opinion.
Yeah, and going along with that, I think there's still a lot of vagueness around blockchain. I think a lot of people are still trying to figure out what it is and how it may impact them. I know we had a presentation on blockchain at our AMA interim meeting, which I found to be really informative, because personally it was an issue that I do not feel like I'm any terms of an expert on it. And I know that also what I read, I think in one of the reports, is that capital market spending really is on the rise for blockchain. And I think in 2019 so far, or I think actually it was an estimate for 2019, they're projecting like 400 million spent capital market on blockchain. So I think it's certainly a trend to watch, and I'm really curious to see kind of by the end of the year what's happening with it, and frankly to learn more about it.
Thank you, Ed and Amanda. The next question, is there any activity in Congress or by HHS to push any of these new technologies?
Amanda, do you want to try this one first?
Oh gosh, yeah. So I don't work on our policy team here at the AMA, so I'm not sure I'm the best person to answer this issue, but I know that, so here at the AMA, we've convened an internal work group of internal, what we call stakeholders in AI, and we've been really working to learn a lot more about it, and we have had presentations internally about some things that are happening with Congress and HHS. So I can certainly point, if you'd like to email me, you in the right direction with people to speak with, but I know there's a lot happening, and here at the AMA, we recently passed a policy at our 2018 meeting around AI, and we have a lot of activity around digital health. So I'm happy to provide more information on that or point you in the direction for the right person for that.
And Amanda, I'd add to, what I've heard or what I've read, there's certainly a focus on CDC and ONC about, leveraging analytics and, getting insights into population health, it's part of their writings. I think you'll even see it mentioned in the interop or some of the data that's coming through. I would, first of all, apologize, by the way. I'm at an airport. Here's a plane that just flew over me. I would encourage you to go to the WEDI conference that's coming up here next week. There'll be some presenters that will be focused on that very topic. And certainly, monitor some of the WEDI seminars that are coming out and, other educational resources. But good question, though.
Thanks, Ed and Amanda. Next question. Wearables and at-home device integration were the rave the last 2 years. What will be their role in the next couple of years?
Oh, yeah, I'll go first, Amanda. It's an awesome place to gather information. There's certainly privacy concerns about wearables. As my opinion is the more of the applications are being built for members to manage their own care. Integration with these devices combined with the information being displayed by both providers and health plans is going to be very, very valuable for the patient / member. So I suspect it's going to be a very important feed, to the full informational picture.
Yeah, and what I think too, I think we're going to start seeing more regulation around wearables, apps, and those other devices, because I think right now, there's so many apps and devices sort of swimming around, and even looking at like the store on your iPhone, right? There's trackers for everything, and I know that recently it came out that actually like the Apple Health Monitor, maybe those measurements aren't as accurate. So I think that I'm curious to see as this space evolves kind of from the regulatory perspective, what happens there. And, as these devices are incorporated more into practice too, I think there will be larger uptake, but I think there's definitely some resistance until there's kind of more information out there.
It's interesting. I found another, not necessarily wearables, but having medical devices in the home, being able to publish events. A person's heartbeat's too low or too fast, or your sugar levels are a certain way, and to be able to respiratory conditions and to be able to inform the hospital institution that something's happening with your patient. So it'd be interesting to see how our wearables will be able to interact with more event-based care, especially when you're just us normally living our normal lives. So I'm looking forward to seeing how that evolves.
Yeah, and I think like with remote patient monitoring that you mentioned, I think that, if done correctly and kind of monitored correctly, I think that can really address issues of sort of like barriers to patient transportation issues, barriers to them accessing care because maybe they're in a rural area. So some of these sort of new ways of communicating like doctors and patients with telemedicine or at-home monitoring, I think actually these are an amazing step in the right direction for helping people get the care that they need.
We haven't had any other questions come in. Feel free if anybody has any questions. This is your last chance to get them typed in to ask. Ed or Amanda, would you like to provide any further comments or anything that you'd like to ask the audience that they can, comment in their questions chat box?
Yeah. Amanda, I'll defer to you first.
Yeah, sure. Well, whether it be now or later, I'm definitely curious to hear some of the folks on the phone's perspective on, are these trends in line with what they're seeing? Because a lot of these reports were written earlier this year, and now somehow we're nearly halfway through the year. So kind of curious from the industry experts if these are in line with what they're seeing, or maybe they're seeing some trends that, I didn't mention today and that really weren't top of mind in these reports. And other than that, I just wanted to thank everybody so much again for listening in, and I hope the presentation was informative, and please don't hesitate to contact me with any questions. Even if I can't answer them, I can point you in the right direction of somebody who can.
Yeah. Amanda, first of all, thank you so much for presenting with me. You're an awesome partner. Related to to the health plans, I would ditto Amanda's request. If you have information that differs from what I presented, I really appreciate the conversation. Also, thank you to WEDI for inviting us to speak, and I encourage you all to utilize the WEDI resources more, conferences, webinars, white papers, issue briefs. It's a wonderful place to be. So, and thank you, Sam.
Thank you very much, Ed and Amanda, and thank you for all of our participants. I will be sending out the link to the recorded webinar. Feel free to share with your colleagues or anybody you think might benefit from this webinar. Thank you again. I hope everybody enjoys the rest of their week.
Great. Thanks so much, guys.
Okay, thank you.